Welcome to Riverside University Health System Medical Center. My name is Matthew Fazio. I'm the Perioperative Services Director here. I'm here to welcome you to our operating room here. We are here to help you learn about proper OR etiquette, as well as to not have you have that deer in the headlights look once you enter into the operating room. Please let us know how we can best serve you and welcome you to the department. Hey, we're now in the scrub room here, and you're going to utilize your badge to access your scrubs. On the back of your badge is the magnetic strip. You're going to take the magnetic strip and place it upright, and it's going to go from left to right to access your scrubs. And it doesn't always work the first time. So now you're going to hit collect. And then you're going to grab your scrubs from the desired location, and you'll get your scrub set. One is the top, one is the bottom. So with the scrub machine, you're going to utilize your badge with the magnetic strip. The instructions are over here. If you forget how to do it, you'll swipe your badge and then you'll follow instructions starting with number 2. C is going to be to get your clean scrubs. If you need to change your scrub size, you're going to hit F to change your size, and then you're going to follow the instructions down here for the code to change your size for the code. And then you enter it in there. Then you're going to have to go back and swipe your badge again for that new scrub size. So I'll show you how to do that because I'm going to change my size. So I'm going to hit F, and I want a large set of scrubs, which was 15. Enter 15, hit E for enter. My new scrub size is now 15, which is large. And then I will swipe my badge again, hit C for collect, and collecting my scrubs. I will come to door 4, open it up, retrieve my scrubs. I have my tops of my scrubs, the bottom of my scrubs. Here at RUHS, you can only choose one size, so there's no mixing and matching of the sizes. At the end of the day, you will return your scrubs in the same location that you received your scrubs, and you're going to follow some of the same instructions as you were to receive your scrubs. You're just going to go next to the machine next to it. You're going to swipe through the machine. It's going to ask you to deposit the scrubs. It says top and bottom. It does not matter. Just put a top in this one side and the bottom in the other side. Now you have 2 items received. Now you get credit back for your scrubs. You will receive 2 credits for your scrubs, 2 scrub credits. Please make sure that you are returning the scrubs back. Please do not go home in your scrubs, as they have to stay inside the facility. If you have trouble with the scrub machine, please contact myself or one of the other directors of the operating room. We'll be happy to assist you with the scrub machine. If you throw something away, earbuds, keys, phone, into the scrub machine, please don't panic. Please contact one of the directors. We can assist you in retrieving your device back. So now that you have your scrubs, we're here at the locker rooms, which is directly across from the scrub room. The men's locker room is directly across, and then the female locker room is just slightly down the hall. So once you have your scrub attire on, we'll require you to wear shoe covers, a hair cover, and please don't forget your eye protection. I just want to go over a few things of safety in the operating room, especially on sharp safety. We really want you to be very cognizant of the knife blades, the needles coming back, the suture needles, the local needles that are on the field. We get people who get sharp injuries, and we don't want you to be one of them. So please be cognizant. Watch your surgical tech. Have them show you how to protect the needle if you're suturing, and return the needle back safely so that it's safe for you as well as for my staff that's here. So we're now in the locker room here. We're all ready to go get our first scrub on and get into surgery. I have my OR attire on. I have my eye protection on. You don't need it until you actually get into the room. So let's go into surgery. Now we're in the hallway and we're ready for surgery, and the scrub sinks are all along the halls.
Hi, I'm Brian. Welcome to RUHS. We're going to be learning how to scrub today. These beautiful sinks here are our scrub sinks. And before we get into that, we have a choice of different types of masks up here that you can see. We have one that has a little bit of sticky there. A lot of people don't prefer that one. So we do have one that has ties. It's going to be very similar to this one. We have ones that have eye shield protection. One has loops like this, and the other one has ties. Okay. If you choose to wear one of the smaller ones that does not have eye protection, we do have goggles here for you. You need to make sure that you have this at all times when in any surgery, because we're here for safety, the patient's and our own. Okay, as you can see, I'm wearing my nice scrub cap, and I'm wearing my beautiful scrub booties. These need to be worn at all times, as well as our masks, so that we ensure everything is nice and safe for the patient and ourselves. Okay? As you can see here, we have 3 different types of scrub brushes. We have one that's 4% chlorhexidine gluconate, 3% PCMX, and one that has no detergent. The choice is yours which one that you wish to use. Typically, I go for the 4% chlorhexidine gluconate because the one that does not have detergent, we typically have 4% chlorhexidine gluconate here at the scrub sink. You are free to use the 3% PCMX, it is just as effective. And I'm just going to go ahead and choose one for my scrub start. Okay? So the first thing I want to do is make sure I'm all ready. I have my shoe covers, I have my mask, I have my eye protection here, and I have my cap. So now that I have my bar of soap, we will also notice, before I get started, we have a couple of foot pedals here down at the bottom of the sink. The left one is hot, the right one is cold. Typically the OR is a little bit colder, so I usually go warm. There's also a nice red pedal here that dispenses our soap up top, which I will show you here in just a moment. Just like that, okay? So now that we're aware of everything that we have in our scrub sink, I'm gonna go ahead and open my scrub brush. As I'm opening my scrub brush, you will notice this nice little blue fingernail pick, okay? That's what we typically start with. I try and keep this as clean as possible and set it here on the side. How we are going to start our scrub is with our fingernails. So I'm going to step on the pedal, and I'm going to run this underneath at least once under each fingernail to get out the primary amount of dirt that we can get out. Okay. Each side. For purposes of this video, we will only be doing one side, and you will repeat on both sides. Once I am done with my fingernails, I will throw the blue nail file away in the trash can or into the sink. Never on the floor. Don't touch anything else. So before we start our scrub, there are a couple important things to note. There's a timed method and there is a stroke method. For the stroke method, it's 10 strokes per side. For our fingers and arms, we count them as 4 sides. Okay? We will always start from the fingers and work our way down to the arms. You will always scrub up to 2 inches above your elbow. And that's where we're aiming for. So I'm right-handed. I typically use my right hand to scrub my left first. And I always want to keep my fingers above my elbow. Okay? So I'm going to go ahead and get started. I'm going to grab this with my right hand. Remember, we're not aseptically clean yet, so I can go ahead and grab that. I can do what's necessary. I'm going to go ahead and step on the pedal, soak it up a little bit. It's nice and soapy, as we can see. I switch it to my other hand, get it nice and soapy. We're ready to scrub. I start with the fingernails on my right hand. Okay. Always keeping my fingertips above my elbow for 10 strokes or 10 seconds. And then I move to each finger, 3, 4, 5, 6, 7, 8, 9, 10. You will do that for all 4 sides. For purposes of the video, this will be hastened. So 10 strokes, I'm only doing a few for purposes of the video. As I scrub each finger, I'm getting every side of my finger. I'm doing 10 strokes or 10 seconds. Most people prefer strokes. It's a little bit easier. Now that my fingers are all done, I'm going to start with my palm. And I'm also going to do 10 seconds with my fingers above my elbow. Turn it over, fingers above my elbow. Once I'm done with my hand, I would switch to the other hand and continue. As you will notice in the scrub brush, there is a rough side and a soft side. When starting with the hand, I typically use the rough side and the soft side for my arm. So as we continue to scrub, I'm going to start from the very top, break my arm into half, and scrub down. It's okay to scrub up, but you never want to go back up from your elbow back. So I would do this 10 strokes. Second side, 10 strokes. Third side, 10 strokes. Fourth side, 10 strokes, fingers always above my elbow. I cannot stress that enough. Once I'm done with this half, I come 2 inches above my elbow, 10 strokes. Second side, 10 strokes. Third side, 10 strokes. Fourth side, 10 strokes, getting above the elbow. Now we're done successfully scrubbing both arms. We're going to take our scrub brush, throw it in the sink or in the trash. Never place it down. Once you hit anything like this, I must re-scrub. It's okay. We all have accidents, but that is what we must do. So I would take a new scrub brush and I would begin all over. For purposes of this video, I will continue. Okay, both arms are scrubbed. We're going to step on our pedal and get the flow of running water. Now what you want to do, starting with your fingernails and fingertips, you scrub under. I like to turn as I go to get as much soap off as I possibly can. All the way up. And that's it for one arm. And then I switch. And I will do the same for the other. Fingers always above my elbows. Okay. Now my arms are wet. I have to let them dry. There's a mat on the floor. If you're not as tall as me, which most of you aren't, you can kind of drip them into the sink. I like to drip them over the mat so I don't take that with me. So here we have the surgical hand antiseptic that we can use after our first scrub of the day. Our first scrub of the day is going to be how we showed you earlier in the video. This does contain alcohol in it, and it is very important that we do 90 seconds of scrub time minimum. It is a little bit more easy for an application. As you will see, as I'm right-handed, I will put my right hand under, give it 4 pumps, 1, 2, 3, 4, and then I will begin. I have my fingernails that I do first, about 10 seconds. Okay. Then I will place my left hand under, 1, 2, 3, 4. As you can see, some of it's drying, and I will do these fingernails 2, 3, 5, 6, 7, 8, 9, 10. And then we begin to scrub as we normally do. Hands above the elbows at all times. Interlocking fingers if you can. Okay, and then behind Fingers above elbows at this time. And I turn my arm as I come down, and that arm is done. If you need a little more, you can always reapply. However, most of the time it is sufficient with 4 pumps. At this time, I've done my 90 seconds, and I can proceed into the OR, fingers above elbows. As we did last time, 2 inches above the elbow is key. Never keep your arms too high up, never keep them too low. Our waist is where we typically have part of our sterile field up until about our axillary. Our face masks are not considered sterile, so it is very important to keep your hands far enough away from them so that we are not contaminating ourselves. All right, let's go in. First, we're going to hit our OR button without our hands and arms. This opens the OR doors here, and we're going to go on in. Hands above elbows at all times. Making sure you're aware of where your hands and arms are. Keep your eye towards the field. This is where you will be when the surgical tech scrubs you in. I am going to give you the demonstration of how we do this. Our surgical field here is in all blue. We must remain a minimum of 1 foot away when not scrubbed in. I'm going to reach over as little as I can, grab my towel. As I'm right-handed, I will start with my right arm. I put my left hand out, fingers above elbows, towel open, one side. I start with each finger and dry them one by one. I then go to my palm and the back of my hand, drying as much as I can, not going back. Then I proceed down to my arm. As you see, as I get closer down here, you can see how much closer it gets to my gown. I may bend forward a little bit and finish the rest. Now that this arm is done, we're going to go under the towel with our right hand. It's being a little difficult, but we will get there. And do the same process on this side. Finger one by one, as so. The palm and back of hand, and down. As I come down, I lean forward just a little bit. As you can see, it gets very close to my badge, and we're done. From here, you want to place this on the floor, in your circulator's hands, or the trash receptacle, if possible. My circulator comes, takes away the towel, and I'm ready to gown and glove. I pick up the gown with my left hand. There is a U shape, or a V shape here that will go up my neck. There's one armhole here, and one armhole on the opposite side here. I will slip my arms through, not touching anything as I let it slide down my back. My circulator will come and tie me up. There are 2 Velcro pieces at the top, and a tie at the bottom, one inside and one outside, that he will tie up as I put on my gloves. As I'm right-handed, I will start with the right glove. And there should be a thumb here on the glove. I will make a little pinch and flip it over on my hand. This is the most difficult part of scrubbing for most individuals. Now at this moment, I will no longer turn away from the table because I am now in a sterile garment. The sterile field is my priority, and my back is no longer sterile. The white part of the gown here is also not sterile because you can see through the white part of the gown. So it is not non-permeable. I will go ahead Take my left glove out. Thumb component is here facing me. I will pinch at the edge, and we will flip into our glove. This is the hardest part. It should look something similar to this. Sometimes you may see something like this, which is a lot more complicated. You will work as best you can to get your glove on. Until you have two gloves on, you are not able to pick at the gloves. You are welcome to pull down once you have a glove on at the gown here very gently, because it will rip and tear and you will have to repeat the process. Once I have my first set of gloves on, I will go to my second set of gloves. Since I have two gloves on, I can pick and touch anywhere on this glove that I choose. I will again start with my right hand, place my hand inside, flip it over, and we put our right glove on. I will then start with our left glove. Anywhere we can touch. If I did not have any gloves on, I can only touch this inner part because the outer part is considered sterile. I can use both hands to put this on. And you've now completed the last part of your scrub. The only other remaining step requires your circulator or another scrubbed in person where you have two parts of the scrub. Here you can see on the blue part, that is where the circulator non-sterile person will touch. As I turn towards my left and grab from the circulator keeps the card because it will be non-sterile, and we tie our gown. At this moment in time, we try and keep our fingers above our elbows at all times, nowhere near our face, and above our waist. For me, I'm a little bit taller. Most average people will come to about here. So your sterile field will be about from your axillary line into your tabletop. Okay? Now I'm awaiting Dr. Siegfried, who will be joining us momentarily, and I'll show you what to expect of how they will gown and glove you each. As we wait for Dr. Siegfried, I'd like to cover a couple more things that are important to our sterile field. Jewelry, earrings must be covered at all times. Any type of rings should be removed. Eyebrow rings, belly button rings, anything of that nature, if it is not covered, must be removed. Our t-shirts must be confined within our overall surgical scrubs. And we cannot have anything hanging outside of our gown and gloves. As you can see in this video, I have a microphone, and that would not be considered sterile. I would also like to point out that right now, I have my hands in a relaxing position. So most of the time, when you guys will be scrubbing, you will be retracting and doing things for long periods of time. I have recommendations for this so that you are able to complete your surgery in the most comfortable method possible. First, I have the elbow grab, where I grab both components, and that way I can let my arms go. I also have the hand hold, where I can hold either hand. And there's one last one where you can grab your gown and hold it. But this one I don't recommend as much because you can tear your gown. Let's see where Dr. Siegfried is and gown and glove her.
Good morning, everyone.
Good morning, Dr. Siegfried.
How is everybody this morning?
We're doing great.
Okay, I'm dry.
Dr. Siegfried is dry, so she does not require a towel. I'm going to take, as the sterile person, the gown up from the arm side, and at each side here, you will have a green line that we're going to hold on to. As Dr. Siegfried awaits me, I'm going to bring it out. It will fall down on its own. You will be more like Dr. Siegfried than anybody else. I must cup my hands to make sure that I remain sterile. Dr. Siegfried, as you can see, she maintains her arms above her elbows. I let go. We start with the right hand, and we'll open her gloves. Okay. We're going to start with the right hand. I'm actually going to place this down because I don't want to form any bad habits. We're going to open, thumbs out. Dr. Siegfried is going to come in. And her first glove is on. Now we'll come to her second arm. And you bring it down to about the first joint in the knuckle. And we will repeat the process. Thumbs out. I will come down so Dr. Siegfried does not have to come up to me, remembering my sterile field ends at my hips. Dr. Siegfried's first pair of gloves are on. Most surgeons prefer to do their second set of gloves. If not, what we can do is we can do the process all over again. Thumbs out. The reasoning for this is primarily for the first time that you glove Dr. Siegfried, or whoever you may have. Their hand will not be sterile. As you can see, she will assist me with her finger. And so we need to make sure we do not contaminate ourselves. Never ever be afraid to let a team member know that you or somebody else has become contaminated. As you can see, we're going to take the card. Go ahead, Dr. Siegfried. She gets the strap, I get the card. Never ever be afraid to tell somebody that you've been contaminated. We're all here for safety, whether your own or the patient's. But above all, be honest and have integrity. So the surgery is over. How do you get out of this gown? Well, first, when we remove our surgical supplies, we are still wearing the gown. We can ball them up. And we can toss them out. Toss into any receptacle that has a red or white bag that does not have soiled linen labeled on the top of it. Okay? So we'll toss in there. Now, you have that strap that we tied earlier. We're going to break that strap. I reach at the side at the hip, the side at the hip, and I pull forward. Okay? Now from this point, we're going to ball into ourselves as much as we can. And it's okay to have the gloves not come off. But if they do not come off, let's throw away our gown first. Our surgery could have been very bloody. What you need to do is the 2-scoop method. I take 2 fingers and go on the inside of the glove and remove them. This one is done. This hand is cleaned. I go on the inside, not the outside, of this glove and remove as much as and safely as I possibly can. I'm only touching the middle, not the outside. And we're done. And that's how you scrub. You may now relax.